Welcome back. I'm now joined by Dr. Doug Rock with St. Mary's Cancer Center. Thank you so much for stopping by the studio today.
It's good to be here.
So let's talk a little bit about September and the cancer of the month that you guys are highlighting.
So prostate cancer is the cancer of the month, so to speak. It's National Prostate Cancer Awareness Month. So we're highlighting that this month with a big ribbon displayed on the building and other activities.
So what exactly is prostate cancer for people who don't know?
So the prostate is an organ and cancer starts in the prostate. It's a male organ, so it only affects males, and is actually the second most common cancer in males, second to skin cancer.
Wow,
but
okay.
the most common, or the second most common cause of cancer deaths as well.
Wow, that's a big piece of information.
It is, yeah.
Now, what do you do exactly over at St. Mary's?
So I'm a radiation oncologist, so I use radiation to treat all types of cancer, but also prostate cancer.
Okay, now how do you go about treating prostate cancer with radiation? I feel like that's a scary area to be shooting.
Yeah, it really can be sort of ominous to patients, but it's actually very well tolerated, and we've made some great advances in the past few years to minimize the side effects of radiation. So patients come in every day, Monday through Friday, and recently we've actually been able to decrease the number of doses in a lot of patients from like 40 doses down to 20 doses, and it's every day, Monday through Friday.
Wow. Now how do you do that? How do you reduce the dose by, I mean, you're cutting it in half.
Right, so we've had some great advances in being able to really conform the dose of radiation just to the prostate and minimizing it from going elsewhere. And also, within the past few months, we started using something called space ore, which is a substance that I inject in between the rectum and the prostate, which pushes the rectum away from the prostate, further reducing the dose of that. So it allows us to give a little bit higher dose each day so we can give less total doses, which is much more convenient for the patient. And that causes significantly less toxicity, that pushing that rectum away.
Right, and less time in that center. So you mentioned that prostate cancer is super common in men. How common? I mean, what can people be looking out for?
You know, there aren't a lot of symptoms of prostate cancer. The way it is detected usually is by a blood test called the PSA.
Okay.
And as that rises, that alerts us that there may be a problem with the prostate.
All right, so they got to get screened.
Right. There's some controversy on patients whether they should be screened or not, but they should at least talk with their primary care doctor about the pros and cons of screening, and I get screened every year.
Okay, good to know. Now, if people want to know more or they want to contact St. Mary's, how can they do that?
So we're at the Advanced Medicine Pavilion, and the number there is 298-7500, and they could direct the person to me. I'd be happy to talk to patients.
Great. Thank you so much, Dr. Rock, for coming on and talking to us today.
You're welcome.
Absolutely. We're going to have all this information on westernslopenow.com. Dr. Rock also came in by the studio yesterday and did an interview on our sister station, KREX5 News at noon with Katrin Asaf. That's also available on westernslopenow.com. Check it out.